All right, guys. So when should you use heat and ice for a disc injury, either in the neck or the low back? Should you even use heat and ice? And if you would use it, where would you put it? Do you put it on the part that's hurting, like in the leg, like down in the hamstring or the calf, or do you put it on the shoulder maybe, or the elbow where it's like referred to? So let's get an opinion here. I always want to see, we got Brooke, we got Matt, we have our student Taylor. Let's get a few different kind of opinions on what they advise, our clients and our patients to do when they're having this issue. So we see a lot of people that have, either bulge, herniated, some kind of mechanical disc and spine pain, and the pain is not always in the spine. A lot of times it is, but many times people will feel it in a different area, like down into the arm, or they only feel it in the behind the knee maybe, or even the heel sometimes, and so it feels like it's something different. Like I strained my calf, or I have a heel issue, and so I've been putting ice back there, heat back there. They ask, do I even need to use any at all? So what do you tell people typically, Brooke?
I rarely tell people to use ice. If they want to use heat, that's up to them. Some people like just to use it on their back. Other people like to use it like wherever their pain is referred to, just because their muscles will get tight because of that nerve irritation. So if they like to use it there, that's fine with me. But I hardly ever ice I recommend for people.
Matt, what do you think? So, I mean, I'm kind of still in the old school from being the oldest one here. Like, I will still, even though the research has changed, like she's not like, I still like ice for certain things. Again, it can be maybe just a personal preference, and if you feel like it feels better and it changes that distal symptom, or you feel better overall, you're able to move more, then you could use it. I mean, I'm gaining, and I'm kind of gaining on the bandwagon, with the heat, because that is what the research is showing. There is a certain reason for an inflammatory state to be present, right? If you get hurt, there's a reason for that. And I'm just saying, like, okay, at certain times, re-aggravations, re-irritation, something where I'm just really sore from doing something, a lot of times I still like to use ice for certain things, but it doesn't have to be that. So what have you done in the past?
I do what my supervising PTs tell me to do.
That's a good answer.
Thank you. Yeah, Chris, you are the oldest here, but I think we've actually been working PT maybe just 1 year difference.
Yeah.
When did you graduate school?
'07.
Yep, I graduated '08. So, but he's older. So heat, ice, I mean, still align with them. Heat better than ice. I won't fight someone if they keep telling me, like, no, I feel better with ice. That's fine. Like, you do ice. If it honestly makes you feel better, go for it. Something working where in our clinic, our location, our clientele, we have a lot of patients that don't like ice because they don't like the cold sensation, like where they come from. It's just too much of a shock for them, so they will always choose heat in that regard.
So, I mean, the heat, like the ice, we talk about that, maybe that anti-inflammatory effect, where maybe we don't want to have the anti-inflammatory effect for certain reasons, right? It also has kind of an analgesic effect at times to kind of calm some pain receptors down and make things feel a little better. But the heat can also bring good blood flow, which for disc and spine injuries is important, because you don't get good oxygenated blood flow to the area on its own. It needs movement and activity and things to kind of squish and get those cells to that area. So that may be one reason why we would use the heat in that spot. Now, what about location? So if I don't have, if I have back pain or neck pain, it's pretty obvious we put it right in that spot. What if I only had calf pain, and based on our assessment, we know that it's coming from the low back? We can change it. It's intermittent. It shows a directional preference, like all the things that we talked about, and maybe we've seen on the different videos. Would you put it on the calf where it hurts, where you actually have the pain? Would you put it on the back where the source of the pain is? What do you think?
A lot of times I'll leave that just up to the patient, what they want to do with it. So like I said, sometimes if you do have the calf pain and it's not actually coming from your calf, those muscles can still get tight from that nerve irritation. So if it helps, I mean, why not put it on your calf? If you put it on your back and it doesn't really do anything, then don't put it there. Kind of, if it helps, do it. If it doesn't help, you're a little bit wasting your time with it. So just depending on the patient.
I agree.
So I would try it, try it like with both, right? So initially, I think I would probably try it on the low back first, because and I'm saying after we know that we're sure that the origin, where it's coming from, we're very certain of where it's coming from. Even though we know you feel it in the calf, I would try it probably centrally first to see if it does change that. But like Brooke said, if it doesn't change that, there's nothing wrong with going to a different spot to see if all of a sudden now that makes the calf feel better. It's all about, remember the rules of red light, green light, yellow light. If you can take and change that most distal or the furthest away symptom and reduce that, and it feels better, and then two, mechanically, okay, I move better, then it doesn't matter where you put it. As long as that you're getting that result, that's the key. But try it in both places. Now, let's ask Taylor, because this is so, again, we've been out of school for a little while and do things. He's still currently in school learning. Have they talked about that? Have they changed any of the protocol, say, so to speak, with heat, ice, where to put it, whether to use it, whether to not use it?
Yeah, so our professor, I'm from Des Moines University, and our professors kind of really talked about kind of the change from when at first is a lot of research and people saying that you need to ice all the time, ice, ice, ice. And now you're kind of getting more research kind of in the field that shows it's maybe not as effective as they saw once before. So now kind of what we're learning kind of in school is kind of what they've kind of been stating is kind of maybe staying away from ice unless a patient really believes it works type of thing. And then also same with the heat, going towards if it feels good, if they're feeling good, it can be a really good thing to add in. So,
okay. Excellent. And that's part of the reason why we continue to, have to pay attention to the research and the way things change, right? It wasn't that long ago that people would, after an ACL injury or a surgery, were put in a brace for 6-8 weeks. And then it was really so. As we learned this and we get better and better, we have to adapt to those things. Now, of course, we're moving them the day after. Same thing when it applies to, a mechanical spine issue, which we deal a lot with on the disc side. The common thing in the past, the old school, okay, well, just rest, don't do anything, don't move, go bed rest for, a week. No, we know that is not right anymore. Like that used to be the case. It's no longer shown to be effective. It's much more effective for early movement, early intervention, finding some things that do help improve that pain, especially the distal pain, as quickly as possible. So that's really what I wanted to cover today. I think we got it all covered on the heat, ice, whether to use it, whether to not, where to put it, all that kind of thing. So any questions, let us know, put them in the comments, and we will get back to you as quickly as we can. Thanks.